Hi, my name is Dr. Lucy Meier from Third Coast Foot and Ankle, and today we're going to talk about injections, specifically common myths about injections in our foot. So first thing we need to discuss is all the different kinds of injections that you may receive in your foot. Now, most commonly, when we're talking about injections, we are talking about an anesthetic. So this is something that is going to numb an area on your foot, like a local anesthetic, which is typically done with an injection, or a cortisone injection. So cortisone is an anti-inflammatory, things that we use during injury or for pain management reasons. There is also PRP injections. This is type of regenerative medicine injection that allows the tools for your body to heal. Those are kind of the ones that I'm going to talk about basically because they seem to be the more common ones. There are other ones, but we'll focus on these. So myth number one is that injections are always super painful in the feet. Now, it's an injection, so I'm not going to say it's pain-free. There is a needle entering your body, and that's an ow. But it's usually not as painful as what people are expecting, and we hear that so often. As it didn't feel nearly as bad as what I was expecting it to feel. So what we really tend to experience is more of this really pressure sensation. So there's the pinprick of the needle going in, and then there's like a ball or a balloon being filled up inside your foot. And so for some people, it's very minimal pain, but on the contrary, I would never want to diminish anybody's discomfort. It is obviously sore and sometimes described as very painful, but they are not always the worst thing you're ever going to experience. Number two is that we only use injections in worst case scenarios. And that's definitely not true. So there are a lot of different injuries, different types of pain that we're dealing with, that we use cortisone at all stages of that disease. And sometimes we're using it for different purposes, right? But if somebody is offering you an injection as part of your treatment plan, because that's typically what it is part of a treatment plan, not the treatment, don't be surprised or don't assume that means that you're in a really, really bad state, because it may mean that this is going to give you the best option at a smoother recovery at this point of your disease. And that can be early or later on in the disease, depending on what we're dealing with. Myth number three is that they're terribly expensive. Healthcare is expensive, so we know this. We're all seeing it and noticing it, that it's costing us more to receive healthcare. But I would not put injections at the top ticket item as things that cost us a lot of money. They're actually quite reasonably priced when we compare them to other things. The other thing to consider too, when we look about the expense of the healthcare options that we're choosing, is really your path to recovery and what is going to be needed along the path, right? And so anytime that I'm prescribing an injection, it is not a standalone treatment. It is a part of a plan. And so there are typically options for most individuals for their recovery plan. And certain things might take longer to get you better. Some things you might see a faster recovery time. And then the longer you're engaging with healthcare, obviously the more pricey it can be. So also if you're missing work or things like that, how this is affecting your life is something to really factor into that expense. What is it costing you in dollars? What is it costing you in lifestyle too? We here at Third Coast Foot and Ankle are very transparent about all of those things and happy to talk through those decisions with you so you understand them. Right now, another myth is that injections just cover the pain up. And that is partly true, right? So we are sometimes using these different things as a pain management tool. Specifically, I'm going to talk about cortisone. So if we're using a cortisone injection in an arthritic joint, it's not treating the arthritis, but it is decreasing the inflammation and the pain that you're experiencing. And so it is an option if our goal is to see lower pain levels, and in some situation it is the best option to move forward. There are some injuries that we do use it to help with pain, but more importantly, it's changing the inflammatory cycle or what's happening there at a cellular level where your body is trying to heal. And our body can really benefit from that change, and it can be allowed to heal. So depending on where your injury is at, and at what stage, these injections can have different effects on the healing process. And so that's an important thing to kind of understand or have your doctor explain to you what are the goals of this injection. And oftentimes it is part of a bigger framework of your treatment plan. It is not the treatment of your injury or disease. So I hope that this answered a lot of your questions about injections, because it is scary. And I see this with my patients all the time. There's a lot of uncertainty on whether or not an injection is right for them when we are discussing it. For a lot of reasons, I am not a big proponent of cortisone in all situations, but I do think it's an extremely useful tool, and we do use it on a daily basis in the office. And so there's a lot that goes into the science and the medicine on when these injections are appropriate, but then also whether or not you're comfortable with it, because that's a huge part of it. It's your body. So if you liked this video, please hit the like button. That helps us out a lot. If you have more questions, please leave them in the comments. And if you need more help, please feel free to reach out to us. Once again, I'm Dr. Lucy Meier at Third Coast Foot and Ankle.